remember that name. It just takes a lot longer. On the other hand, there are things that are concerning and should make one look further. Particularly if you're having trouble doing something that you've always done, driving somewhere, doing your taxes, filling out a checkbook, cooking. If those are things you've done without any trouble and now they're becoming harder, then it's time to go to a professional and look into whether there might be something that can be fixed or to at least get a proper diagnosis.
I knew that she was getting more forgetful.
Yeah.
I didn't think too much about it. I just thought, well, you know.
Yeah. You must have been concerned because you were calling her every day.
Well, I mean, I was concerned, but maybe I was more concerned than I realized.
Yeah.
She would seem to be having difficulty, and I thought, she just doesn't want to set the table. This isn't good. I have to push her. So I would push her, and all of a sudden she broke down and just said, I'm so sorry. I've just forgotten.
I took her to Florida, and that was the first time that I had been with her on a continual basis, 24-hour basis. And I noticed, like, late in the afternoon, periods of confusion. Where are we? She thought she was back in Catonsville, where she lived at, and I mean, and it happened every day we were there.
Yeah. Memory problems, this should also trigger concern. If you forgot an important event 10 minutes or 30 minutes after it happened, that's serious. If someone tells you that you've asked the same question 3 or 4 times in an hour, that may well indicate that there's some serious problem going on and that you should have it professionally evaluated.
I had asked him why he seemed to be buying and selling so much of our stocks, and what was he doing, and what did we, and he couldn't tell me. That was the one that made me know that we really had a problem.
I was keeping much more of a watchful eye on things that she was doing, and I noticed she was starting to have problems with being able to write a check. Just being able to understand bills.
Yeah.
She was getting, so she couldn't take care of her finances.
And then very slowly, what started to happen was, if I was on the phone with her, she would turn around and ask my father, where did we go? What did we do? And I thought that was very strange. So that was my first inclination, that something.
The majority of people with Alzheimer's disease never know that they have a problem. I actually believe that it's the disease itself that blocks awareness. But that presents a real challenge to the family or the caregiver, because that often leads the person to say things like, well, I'm just like all my other friends who can't remember a name every once in a while. One of the things that I suggest that might get the person to the doctor is to say, well, I just feel better if you got it evaluated, and if I'm wrong, I'll be happy just as you are. That can sometimes help the sick person accept an assessment, even though they don't think they need it.
And my family doctor did not tell me that until a couple years later, when Jim was really getting worse and I wanted him reevaluated, and he said, what for? I said, so I know what I'm dealing with. Well, Jim and I were both relieved because Jim felt like he was going crazy. He used to walk around the house like this, holding his head. Something's going wrong up there. I don't know what's happening, and I don't like it.
So getting the diagnosis actually made him feel a little better.
Yes, it did.
I think it's important to have a thorough professional assessment whenever there's a question about somebody having a serious memory or cognitive problem. Sometimes you find out that there's not a problem, and that can be reassuring. But even when you find out that there is a condition, it's important that a person be thoroughly evaluated to make sure that there's not a treatable disease, or that there aren't medical or psychiatric problems contributing to the memory problems. And finally, even if the diagnosis is Alzheimer's disease, to find out in a positive way what can be done to help the person live a better life and to help you as a caregiver do a better job in helping them care for themselves.
I mean, we all knew that but by this time his memory was going, and he wanted me to go with him to the doctors and actually sit in on what the doctor would tell him.
It's important to realize that sometimes there are treatable medical or psychiatric problems that are inducing memory trouble, and if those are fixed, the person can recover. But even if the diagnosis is Alzheimer's disease, there's